I was just using the restroom.
No problem. My name is Anna. I'm a nursing student here at Kilgore College, and I'm going to be doing a head-to-toe assessment on you today, if that's okay.
Yeah, that's fine.
Alrighty. Can I get your name and date of birth?
Brittany Dodd, May 15th of 92.
Do you mind if I check your brand? Perfect, Brittany. Do you have any allergies?
No, I do not.
Do you know where you're at?
Kilgore College.
And do you know why you're here?
Just a routine appointment.
Okay. If you will, I'm going to get some vitals on you.
Okay.
Just put that there. Here's your temperature. Okay, perfect. Your temperature is 98.7. Your oxygen is 95 on room air, which is great. Okay, and I'm going to go ahead and get your blood pressure. Is there an arm that you prefer me to do your blood pressure on?
You can just do this one.
And do you have a normal range that your blood pressure usually runs?
Yes, it's usually about 110 over 70.
Okay. Have you had anything to eat or drink today?
Yes, I had some chicken and rice at lunchtime with a cup of water.
Okay. Is it pretty normal for you not to have breakfast?
Yes.
Okay. Your blood pressure was 124 over 76. Are you in any pain today?
No, I'm not.
On a scale of 0 to 10, 0 being no pain at all, and 10 being the worst pain, what would you rate your pain?
A 0.
A 0? I'm going to get your heart rate real fast.
Okay.
Okay, your heart rate was 86 and your respirations were 16.
Okay.
So I'm going to go ahead and start performing the head to toe assessment. I'm going to start with your head. I'm just going to inspect your head.
Okay.
Alright. Have you had any pain to your head at all?
No, I have not.
Okay. I'm going to feel and palpate your head if that's okay with you.
Yes, that's fine.
Okay. I'm just feeling for any lumps or bumps. Any pain through there?
No.
Okay. Alrighty. I'm gonna go ahead and feel for your sinuses, see if there's any tenderness there, okay? Any tenderness through there?
No.
Alright, perfect. Okay, I'm gonna go ahead and look in your ears. Have you had any pain in your ears lately?
No, I'm not.
Okay. If you'll cover your other ear, I'm just going to do a hearing test on you.
Okay.
Just repeat the 3 words after me, okay?
Okay. Rough black hearing.
I'm going to inspect this other ear for you real quick. Okay, if you'll cover that other ear.
Blue sock house.
Perfect. Alrighty, I'm going to perform an eye exam on you. I'm going to shine this light in your eye, okay?
Okay.
You'll just look at me. Okay, perfect. Alright, and if you will, look at the tip of my pen, and then you're going to look at the wall. Pen, wall, pen, wall. And follow my pen to your nose. Perfect. And just with your eyes, if you'll follow my pen. if you will, look up. I'm just gonna check in your nose. Perfect. Okay, with your nose, if you will, go ahead and cover one side and smell it, and then the other. Okay, perfect. And then open your mouth, stick out your tongue, say ah.
Ah.
Perfect. Alrighty. Okay, and then if you will, turn and look at the window that way, and then look this way. And then I want you to lean your head towards your shoulder, and the other one. Okay, perfect. And if you will look up and down all around. Perfect, okay. Any tenderness in there?
No.
Okay, if you'll lift your shoulders. Okay, perfect. All right, I'm gonna go ahead and listen to your lungs, okay?
Okay.
If you'll sit up, once my stethoscope places, touches your back, if you'll just take a deep breath, okay?
Okay.
Each time. Okay, I'm gonna listen to the front, okay?
Okay.
I'm gonna go ahead and listen to your heart, okay?
Okay.
You'll lift your breath. Okay, perfect. Do you have a cough?
No.
A history of a cough?
No.
Okay. Alrighty, I'm gonna lay you back,
Okay.
and I'm gonna go ahead and assess your stomach. Do you use any assistive devices to walk or to get up or anything like that?
No, I do not.
Okay. Are you comfortable there?
Yes.
Okay, so first I'm just gonna inspect your stomach. Okay. I'm gonna go ahead and listen to your abdomen, sorry. When was your last bowel movement?
Earlier today.
Okay, I'm just gonna palpate here. If there's anything that hurts, just let me know, okay? Anything? Do you usually go pretty normal every day, or
For the most part, I go once a day.
any problems going to the restroom, peeing or pooping?
No.
Any pain through there?
No.
Okay. Sit you. Oh, wrong one. Sorry about that.
You're good.
Okay, so we're gonna go ahead and do a range of motion with your arms
Okay.
and your upper extremities. So if you'll just repeat after me, we're gonna start with your hands out like this, flip them over, up, out. Okay, and then I'm gonna go ahead and assess your capillary refills on your fingers. Okay, if you will squeeze my fingers. Perfect. I'm just gonna feel for your pulses real fast. Okay, perfect. I'm gonna go ahead and feel for your other pulses, okay?
Okay.
And we'll go ahead and assess your range of motion in your lower extremities as well. I'm just gonna look for some edema, if there's any there. Perfect. test your capillary refills here. Toes. Alright. And then if you'll point your toes up, we're just going to test your strength, okay? So push against my hands and pull. Okay, perfect. Alrighty, and now we're going to do your range of motion for your legs.
Okay.
So if you will, we're going to start with your left foot. You're going to bring it up and then out and then bend your knee. Perfect. Now we're going to do your right. Up, out, and bend your knee. Alright. Okay, so I think that is all that I need. Do you need anything else?
Nope, that is it.
Okay. Well, if there's anything else, your call light is there. Just let us know, okay?
Okay.
So my patient was here today. Her hygiene was good. Her face symmetry was symmetrical. She was happy, smiling. Her skin was appropriate for ethnicity. Her hair, skin, and nails were appropriate and clean. Her eyes, Perla was noted, and they were a 3 millimeter. Her nose was moist, and mucus was there. Her mouth was pink and moist as well. She passed her whisper test, 3 out of 3. Range of motion for her neck was noted and intact. No JVD, and her carotid pulse was noted. All pulses were noted, +2 to all pulse sites. Her breath sounds were even. The symmetric, her front, posterior, and anterior of her chest and back were symmetrical. Breath sounds were noted in all lobes, clear, and her heart, S1 and S2 were noted, and the PMI was palpable. Her bowel sounds were normoactive. There was some borborygmus there, however, that was pretty normal. And then her range of motion for her upper and lower extremities was intact, and her capillary refills were less than 3. Her skin was appropriate for ethnicity. I remember I said that. Her strength in her upper and lower was strong. Range of motion in upper and lower extremities was intact. And her hygiene and mood were good. I think that is all. Her nutrition was appropriate for her as well.